Hypoglycemia is a seemingly harmless condition, but it can lead to serious consequences when not treated correctly. Below, understand better its characteristics, what are the most recurrent symptoms, and the common causes. What is hypoglycemia? Hypoglycemia is a condition characterized by exceptionally low levels of sugar, glucose, in the blood, and it is a more common problem in people with diabetes. However, hypoglycemia is not necessarily diabetic. It can be identified by measuring the glucose levels. Generally, the normal level is between 70 and 100 milligrams per deciliter of blood. Thus, in hypoglycemic conditions, the glucose is below the limit of 70 milligrams per dl. As a consequence, the functioning of certain organs can be affected, especially the brain, which is more sensitive to low blood sugar levels, since blood sugar is its main energy source. When this occurs, the brain response stimulates the adrenal glands to release adrenaline and cortisol, the pancreas to release glucagon, and the pituitary gland to release the hormone GH, and then the liver, which secretes glucose into the blood. But still, in some cases, even the release of these hormones fails to raise the sugar level sufficiently, which can lead to a lack of energy to the brain, which can result in mental confusion and even seizures or complete loss of consciousness. The difference between hypo and hyperglycemia. Although the terms are similar, hypoglycemia is a dizzying drop in blood glucose levels that leads to malaise. Hyperglycemia, on the other hand, is characterized when the pancreas does not produce enough insulin, or does so inefficiently, as in cases of type 2 diabetes, resulting in too little glucose in the cells and too much sugar accumulating in the blood. Symptoms of hypoglycemia. Hypoglycemia is usually accompanied by symptoms. Among the most common are mental confusion, dizziness, fainting, sweating, palpitations, increased appetite, headache, tremor, pallor, low motor coordination, difficulty concentrating. Causes of hypoglycemia. Most cases of hypoglycemia occur in people with diabetes and are caused by dysregulation in insulin levels, or even by medications used for diabetes, which lower glucose levels in the blood. In addition, diabetics who drastically reduce their intake of certain foods or who suffer from chronic kidney disease are more likely to have hypoglycemic conditions. In other circumstances, the condition can be motivated by excessive use of alcohol without food, cases of advanced liver disease, such as hepatitis or cirrhosis, impaired glucose production or storage by the liver, heart failure, or even food reactions, such as by overconsumption of carbohydrate, generating excess insulin. What is the treatment for hypoglycemia? A common question is what to do when the glucose is low, that is, when the person is presenting a hypoglycemic state. The answer is quite simple: sugar should be consumed to raise blood glucose. For an immediate improvement, the ideal is to opt for fast-absorbing carbohydrates, sugar, honey, fruit juice, and sweets in general. For a longer effect, you can opt for slower-absorbing carbohydrates, rice, potatoes, and whole grain items. The consumption of artificially sweetened foods is not recommended because they interfere in a non-significant way in the improvement of the glycemic index. In case of hypoglycemia in diabetic people, when the problem is related to the use of diabetes medications, it is recommended to align with the doctor in adjustment to the medication dose in order to avoid complications. Can hypoglycemia kill? Hypoglycemia can lead to death in severe cases, although it is not common, as it can be easily treated. However, when the blood sugar concentration is not regulated, the person can lose consciousness and even go into a coma.